Okay, during my fellowship in neurology, I had the opportunity to get in touch with different types of epilepsy, and it was particularly fascinating to observe the fact that the seizure manifestation, the clinical manifestation, were so different among different patients. In particularly, I was fascinated by a form of epilepsy which is called a reflex epilepsy, in which these seizures are determined and triggered by specific external stimuli, like looking out of the windows or hearing a noise or thinking about a food or singing a song. And you know, in a nutshell, what does it mean? It doesn't mean that epilepsy is really associated with impairment of neuronal circuits, neuronal network. And so that's the main reason for which I decided to follow up my studies on the epilepsy field. So during this period, I learned how it's important not only focusing on epilepsy and seizure control, but also asking and aiming for better quality of life of people dealing with epilepsy. This is very fascinating, of course very challenging, but I think is also the nice part of our job. Okay, thank you for asking. In Italy, there is a very capillary epilepsy network. So there are a lot of centers widespread in the different regions of the country. And I think we have a good level of clinical assistance of these patients. On the other hand, there is also a good networking among clinicians, and this is again a positive thing. What can we improve is the level of general awareness of epilepsy, especially among primary care physicians, because there is still ignorance. There is still insufficient knowledge about the potential treatment, pharmacological and non-pharmacological treatment. And this is a problem not only for physicians and for medical class, but also for people with epilepsy, because it is sad to say, but still there is a strong stigma. And people with epilepsy still feel embarrassed, still is difficult to talk about epilepsy. So I think that a higher level of education and implementing a knowledge about the epilepsy and this treatment, I think would be a step forward for the better treatment of this condition. In the last 2 or 3 decades, there have been significant improvement in the epilepsy field. The first one has been increased knowledge about the genetic etiology of epilepsy. Over than 1,000 forms of epilepsy have been so far linked to different genetic different genetic etiology. And this is resulting also in what we call precision medicine or precision medicine era. This means that in the future it will be possible to cure a single genetic disease with a specific drug. The second is the emerging rule of non-pharmacological treatment. Of course, anti-seizure medication are very effective, but in some patients, the so-called drug-resistant patient, epilepsy is not treated by conventional anti-seizure medication. And so neurostimulation, some type of diets, and changing also the lifestyle may impact, sometimes even more than the anti-seizure medication, the treatment of the epilepsy. And of course, the third, last but not least, the third one is artificial intelligence, because we are starting collecting data of patients with epilepsy, not only biological omics, metabolomics, metagenomics, genomics, but also from wearables, from digital health. And this is a significant opportunity. Of course, it will take time before getting a sufficient amount of data, but I think that this is a very fascinating topic and will be, the switch to the future.